Erectile dysfunction, or ED, is a common issue that affects many men. It occurs when a man has trouble getting or keeping an erection firm enough for sexual activity. This can be frustrating and even embarrassing. It's important to remember that ED is often treatable. Understanding the causes of ED is the first step towards finding a solution. There are many factors that can contribute to ED. These factors can be physical or psychological. Physical causes include conditions like heart disease, diabetes, obesity, and high blood pressure. Psychological factors such as stress, anxiety, and depression can also play a role. ED is often a sign of an underlying health problem. It's essential to address these underlying issues to improve erectile function. For example, managing stress through exercise, relaxation techniques, or therapy can have a positive impact. If you are experiencing ED, it's crucial to talk to your doctor. They can help you identify any underlying health conditions and recommend appropriate treatment options. Remember, you don't have to suffer in silence. Making positive lifestyle changes can significantly impact erectile function. Simple adjustments to your daily routine can make a big difference. These changes not only address ED, but also improve overall health and well-being. One of the most effective lifestyle changes is incorporating regular exercise into your routine. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Activities like brisk walking, jogging, swimming, and cycling improve blood flow and cardiovascular health, which are crucial for achieving and maintaining erections. Another important lifestyle change is adopting a healthy diet. Focus on consuming nutrient-rich foods such as fruits, vegetables, whole grains, and lean protein. These foods provide the vitamins and minerals necessary for optimal sexual health. Finally, it's essential to prioritize sleep and stress management. When you're well rested, your body can function at its best, including sexually. Stress can have a negative impact on erectile function, so find healthy ways to manage stress, such as exercise, meditation, or spending time in nature. If you're experiencing ED, it's important to seek professional medical help. A healthcare provider can determine the underlying cause of your ED and recommend the best course of treatment. They can also rule out any serious medical conditions. Your doctor will likely ask about your medical history, lifestyle habits, and any medications you're taking. They may also perform a physical exam to assess your overall health. Be open and honest with your doctor about your symptoms and concerns. Based on their assessment, your doctor may recommend various treatment options. These options may include lifestyle modifications, medications, counseling, or a combination of approaches. Your doctor will work with you to develop a personalized treatment plan. It's important to follow your doctor's recommendations and attend all follow-up appointments. Be patient and consistent with your treatment plan, as it may take time to see results. Remember that seeking professional help is a sign of strength and a proactive step towards improving your sexual health. Section 4. Exploring natural remedies. While it's crucial to consult with your doctor about ED, some natural remedies may also help improve erectile function. These remedies often involve herbs or supplements that have been used for centuries to enhance sexual health. One popular natural remedy is L-arginine, an amino acid that helps produce nitric oxide in the body. Nitric oxide is essential for relaxing blood vessels and increasing blood flow to the penis, which is crucial for achieving an erection. Another natural remedy is ginseng, a root that has been used in traditional Chinese medicine for centuries. Ginseng is believed to boost energy levels, improve blood flow, and enhance sexual performance. However, more research is needed to confirm these effects. It's important to note that natural remedies should not be used as a substitute for professional medical advice. Always consult with your doctor before taking any herbs or supplements, as they may interact with other medications or have potential side effects. Section 5. The importance of open communication. Open and honest communication with your partner is crucial when dealing with ED. Erectile dysfunction can strain a relationship, leading to feelings of frustration, shame, and resentment. Talking openly about ED can help alleviate these negative emotions and strengthen your bond. Start by choosing a comfortable and private setting to have the conversation. Approach the topic with sensitivity and understanding, letting your partner know that you value their feelings and support. Listen actively to their concerns and perspectives. Share your own feelings about ED, including any fears or anxieties you may have. Explain that ED is a medical condition that can be treated and that you're taking steps to address it. Reassure your partner that your feelings for them haven't changed. Remember that communication is a two-way street. Encourage your partner to express their feelings and concerns openly and honestly. Be patient and supportive, and work together to find solutions that work for both of you. Section 6. Intimacy beyond the bedroom. While sexual intercourse is an important aspect of a romantic relationship, it's not the only way to express intimacy. When dealing with ED, it's essential to focus on other ways to connect with your partner, both emotionally and physically. Physical intimacy can involve cuddling, kissing, massage, and other forms of sensual touch. These activities can help you feel closer to your partner and maintain a sense of intimacy, even when sexual intercourse is challenging. Emotional intimacy involves sharing your thoughts, feelings, and experiences with your partner. This can include talking about your day, sharing your dreams and aspirations, or simply spending quality time together without any distractions. By focusing on intimacy beyond the bedroom, you can strengthen your bond with your partner and create a more fulfilling and satisfying relationship overall. Remember that intimacy is about connection, and there are many ways to connect with your partner beyond sexual intercourse. Section 7. Taking control of your sexual health. Dealing with ED can be challenging, but it's important to remember that you're not alone. Millions of men experience ED, and there are effective treatments available. By taking control of your sexual health, you can improve your erectile function and enhance your overall well-being. Start by making positive lifestyle changes, such as exercising regularly, eating a healthy diet, and managing stress. These changes not only benefit your sexual health, but also improve your overall physical and mental well-being. If lifestyle changes aren't enough, talk to your doctor about other treatment options. Medications, counseling, and other therapies can be highly effective in addressing ED. Your doctor can help you determine the best course of action based on your individual needs. Remember that taking control of your sexual health is a journey, not a destination. Be patient with yourself, celebrate your successes, and don't be afraid to ask for help when you need it. By taking a proactive approach to your sexual health, you can enjoy a fulfilling and satisfying sex life for years to come.